How do you cope with anxiety before starting breast cancer treatment? In this video, I'll be talking about anxiety, what people are anxious about, ways to cope with it, and some resources that are available for you. So anxiety before starting treatment, I have to say, it's often the case that anxiety is actually worse in the few days leading up to your first treatment, whether it's radiation therapy or surgery or chemotherapy. You're sort of on eggshells. You have no idea what to expect. And it feels like you're about to step off a cliff without being sure somebody will catch you. So it's really common for people to tell us that once they start, they actually felt better. The other key thing is you're going to know and hear all the different side effects, and you are very unlikely to get every single one of the side effects. Before you start treatment, you sign a consent form, not usually for endocrine therapy, but for surgery, for radiation therapy, for chemotherapy, for intravenous therapy. You sign a consent form and you'll see this very long list, almost an unending list of side effects. You will not get all of them. You will get some. You will get, maybe you'll be one of those people, you're watching this and you got a lot of side effects. You will not get all of them. You have to be informed, though, of what can happen. You know, we see a lot of people saying, I wasn't told that could happen. And it's very likely that everything on the consent form kind of washed over you in a wave that was way too big. And also, a lot of people don't want to inform people of every single side effect because we can see your eyes glaze over. So we count on you looking at the consent form. We count on you looking at the information sheets. Break it down, keep a notebook. And the next thing I want to say is, it's all very well and fine for me to tell you you're not going to get all the side effects, and anxiety is worse before you start treatment than during treatment, because I'm not the one going through chemotherapy. I get it. We at Yerbba get it. It's not our bodies. But we have learned from so many of you the things that we share on our videos. What do people get anxious about? They get anxious that the treatment won't work, that the cancer might come back, even with the best treatment. They worry about side effects. That long list I just told you about is so overwhelming. Sometimes there's medical jargon that's used and thrown about, and you don't know what that means. It's really hard to know which of the side effects are more likely to happen versus less. And if it's you, even if it was rare, it happened in 100% of you, right? All of you, the whole one of you got that side effect. So it's not always necessarily helpful to know that this is more common, this is less common, and this is rare, because it's either going to happen to you or it's not. You may also fear not being able to get help when you need it. Who do I reach out to? Maybe you have people at home, but they're not necessarily that effective in helping you when you have a side effect. You may feel very alone in coping. You may also be anxious about not wanting to be a burden to people around you. Let's say they're very caring. They're really knowledgeable, people in your family and your friend circle, but you're used to being the caretaker. That can be really destabilizing. And of course, you're going to be anxious about how is this going to affect my day-to-day life and my job and my role as mother, my role as parent, as friend, as sibling, as child to my own parents. So these are the kinds of things. These are normal. These anxieties are not, you're not overreacting. You're not being over anxious. I don't even know what that means. You are experiencing your feelings just as you are, and they're normal. And you're not going to know until you start a treatment how you're doing. You're not really going to know what to expect until you're in the middle of it. So what can you expect from your care team? The doctors, nurses, social workers, nurse practitioners, physician assistants, everybody involved in your care. One of the most important things you can count on and should ask for is high quality information support. What do I mean by that? I mean information that's given to you at a level you can understand, using language you can understand, not jargon, not medical terms that we're all familiar with that sound like gobbledygook to you. You can expect information that answers your specific questions. So, in Yerbba, we give a lot of general information because we're not part of your care team. Your care team should be able to give you more specific information. How to reach them when there's a problem. What are the risks of treatment? What are the benefits? Is this even worth? Why am I getting this treatment? That should all be crystal clear to you before you start. Do not worry about asking more questions. And you can also let your physician or other members of your team know before the visit, I need a longer visit because I have a lot of questions. And we've said in our other videos, get your questions out early in the appointment. Don't keep them hidden. If you have a list of them in your pocket, get them out early. It really helps your care team know what's on your mind and the type of information support that you need. The other thing is keep your questions crystal clear. Be as clear as you can. In that way, you'll get the clearest, most precise information. I'd like to take this opportunity to invite you to go to yerbba.com to get your personalized Yerbba report. Your Yerbba report is created by looking at your specific medical records, whether you upload them or you give them access to your electronic records. It then cross-references everything we know about your tumor, the treatments you've had so far, and shows you what you might be offered at your visits, including the pros and cons of each. There's also a feature that will show you a list of questions that are commonly asked that are really good questions to ask around that specific topic. And you can take those with you to your appointments. And finally, if you get the premium version, you can ask Yerbba and submit specific questions that are answered by real people who have access to your medical records. The other thing you can expect from your medical team is emotional support. I will say not every doctor is good at this. You may find, and will often find, that nurse practitioners, physician assistants, nurses, social workers, pharmacists can actually provide you more emotional or psychological support than a physician. A lot of physicians do not consider this part of their sort of their sweet spot in terms of what they do well. If you have a doctor who does, and many of you do, thank you for writing in with all of their stories, they can provide that support, but they may want to do it with their whole team because there are others in their team who are trained in providing emotional and psychological support. And then what about ways you can cope? What are some real ways you can handle your anxiety? First of all, make sure you normalize it. Don't let anybody tell you you're overreacting or you're too nervous. You need to normalize it, how you're feeling. That's your real psychological experience. The second thing you can do is try to break down your anxieties into categories and into specific people you're going to ask. So if you're worried about keeping up with stuff at home, write that down, or draw a picture of it, or make little cutout shapes you can put on your refrigerator, and try to get everything out of your head and onto a piece of paper. This works for almost everything, whether you're overwhelmed at work or overwhelmed with your kids' school stuff, is get it down on a piece of paper. The other thing, and we've talked about this before, is set aside 10 minutes to be anxious. Do this maybe right before dinner. Don't do it at bedtime. You can do it first thing in the morning, but the time that I've been told is most helpful is like 4 or 5 before dinner, maybe even before the kids come home. Write down everything you're worried about, and it's all in front of you, and you worry the heck out of it. Just worry, worry, worry. It won't make it happen. Writing your worries down doesn't make it happen. It helps them be less toxic for you, and they're less likely to keep you up at night. So just 10, 15 minutes, you can set a timer, and that's your worry time. You may have a friend you want to call up and just tell them that you need 10, 15 minutes to worry with them. The other thing you want to do is be present in the moment. Look at your feet. Where are your feet right now? That's where they need to be. Tomorrow morning, you're going to get up and you're going to get to your doctor's office and you're going to start treatment, whether it's surgery or radiation or chemo and targeted therapy or plastic surgery. But where are your feet right now? Being present in the moment can stop your anxiety from overwhelming you. And the last thing is ask for help. If your anxiety is making it so that you are suffering to the point of it impacting your quality of life, your sleep, your relationships, your ability to function, ask for help. You don't even need to have it get to that threshold to ask for help. Just name it and ask for what you need. If it interferes with your quality of life, I implore you to ask for help. I've covered a lot in this video. I hope it's been helpful. You're normal. We're here for you. Thanks for watching, and we'll see you next time.